Now, please start your presentation.
Assalamualaikum warahmatullahi wabarakatuh. A very good morning to all of you. I'm Mazli Muhammad Zain from UKM Medical Center of National University of Malaysia. On behalf of my group, I would like to present a paper entitled Innovative Protective Device for Mobile Radiography Examination. This is the overview of the presentation: introduction, problem statement, literature review, research methodology, results, discussion and conclusion, and recommendation. Introduction. Radiographic examination in critically ill patient has caused conflict when performed in the wards. An open ward environment has incurred high scattered radiation hazards to not just the patient who had the radiograph done, but also to the nearby patient. Radiography is used extensively in medical procedures such as in medical imaging. Scattered radiation produced by the X-ray radiation, which is emitted to the surrounding, could impose a detrimental health effect, especially to a medical personnel. In order to minimize exposure to the scattered radiation, fixed radiation shields are installed in an X-ray room, and the medical personnel often wears leaded protective clothing such as full lab apron, thyroid collar, and leaded glasses. This is a picture of a mobile radiography equipment that is used for mobile radiography in the ward. It has wheels to enable it to be moved to a specific location to suit the hospital ward's environment. Mobile radiography are performed at the patient's bedsides, and it requires technologist expertise. The procedures should be performed using standard method. Manual technique is generally used, and ordinary factors such as distance, grids, technique can become a challenge to radiographers who perform the examinations. Mobile radiography is one of the areas in which the radiographer may receive high exposures. Lead apron should be worn. They should maximize the distance when perform the examinations, and the lead shielding must be used for all patients unless it will interfere with the examination part. This is a diagram of the scattered radiation. The problem statement. This is the existing protective device which are traditionally placed in between the patient being examined and the neighboring patient to reduce the scattered radiation. But these protective devices are not suitable because they are heavy, bulky, limited in availability, require long positioning time, and also very expensive. The purpose of this study is to protect the nearby patient from scattered radiation when bedside mobile radiography examination is being carried out. Literature review. The need for mobile chest radiograph in acutely ill patients seems to be a routine in almost all the hospitals, and in fact has increased from time to time, reflecting the increase in the healthcare burdens. A survey done in UKM Medical Center in the year 2006 showed that the mobile radiograph request was about 12% of all the radiographs done in a month duration. It is known to public that this technique will definitely involve radiation exposure. Study done in St. Vincent Hospital, Sydney in 1990, measuring the radiation exposure among intensive care staff nurses, revealed that at a distance of 2 meters from the bed, exposure of staff is nil, and at most points around the bed beyond 2 meters from the radiation source. Several methods have been made to provide radiation protection during the examination, especially to the workers, namely the radiographer and the ward personnel. Noria et al. Reported that there is evaluation of the radiation protection program for the workers that are exposed to radiation, whereby the program enhances the radiation protection framework in Malaysia. Many commercial radiation protective devices are available in the market, namely the LED glass shield, the photo shield, and a full mobile X-ray barrier. Most of these devices are made of 0.5 mm plumber or thick glass as the radiation barrier. However, all of these devices are meant for the staff and need to be placed in the ward in view of the big size. Minimum weighing is around 14 kg with diameter of 60 to 120 centimeters. However, little concern has been given to the patients who are staying besides the patient where mobile X-ray taken. Yao et al. Reported that the distance between beds in Malaysian ward is around 1 meter to 2 meters. This is also similar in other developing countries, whereby Zaman reported that the bed distances in Bangladesh in the government hospital is around 1.2 meters to 1.5 meters. If taking into account the previous study in Sydney as mentioned above, the distance allows some scattered radiation to reach the bedside patients. Sources of secondary radiation include scatter from the patient and X-ray cassette in all directions, from the primary beam, and a leakage from the X-ray tube. Even though it appears too small in radiation dosage, cumulative radiation exposure from medical X-ray examinations has been proven to be associated with increased numbers of chromosome translocations and thus increased risk of cancer. Research methodology. An innovative radiation protecting device was designed using recycled materials from used bed gown to protect nearby patients from scattered radiation whenever bedside mobile radiography examination is being carried out. The device has been designed to suit the existing bed and ward environment and can be positioned in seconds. Measurement of scattered radiation using a surveymeter was done at various positions 2 meters away from the radiographic phantom, which has been given an exposure of 100 kbp and 40 mAs, simulating the actual subject undergoing mobile radiographic examination. This measurement was performed several times with and without the protective device that we designed, and also at different levels. There are 4 zones of the different levels of the phantom. The results were tabulated and analyzed. This is the 4 zones. Zone A for the area of retina, Zone B, thyroid area, Zone C, the breast area, and Zone D is the gonad area. This is the innovative protective device that we designed, 120 cm by 50 cm. This is how it is hung onto the patient's bed railing, and how it is carried along on the mobile X-ray equipment. The results. This is the result of our measurement on the 4 different zones using 100 kbp and 40 ms. We found out that the reduction is reduced up to 81.05%. The graph here show that the dose accumulation before using the protective device and after using it. This is the organ dose reduction in the 4 different zone areas that we measured. The result is the accumulated dose to the neighboring patient without the device was 1.94 microsievert, and with the device is 0.37 microsievert. This means the accumulative scatter radiation from a mobile radiography examination was reduced up to 81.05%. Discussion and conclusion. The protective device, we call it t-rax, is highly recommended to be used in all wards during mobile radiographic examination. The weakness and limitation that we need further measurement and evaluation for this protective device, and the kit is proposed to be used to measure the dose received by the adjacent patient. This will be measured in our continuous monitoring of the patient's dose. Conclusion, this new device, t-rax, has helped to maintain the ALARA concept in the radiation protection policy. It has special features such as light and easy to carry, making positioning of the device fast and less time consuming. This device can be stored easily as it can be attached to the mobile X-ray machine and carried along during the ward rounds. The other conclusion is that the device reduced the scattered dose for 83.87%, reduction of the cost for 815,890 ringgit Malaysia, time reduction for equipment setting from 120 seconds to 15 seconds, reduction of manpower from 4% to 1%. This device is also patient friendly because not only we provide service to patient, and also we provide protection to the adjacent patient at the same time. It is also environmental friendly because using recycled materials, therefore support the eco-friendly policy. This is a video presentation how we use the protective device. The first part of this video is when we use the mobile barrier, traditionally placed, very heavy and very bulky. We need at least four persons to move it around. After the exposure is made, the mobile barrier is moved back to the corner of the wards. These mobile barriers are also very expensive. The second part of this video shows that how our design device is easily positioned, light and easy to carry, and has less time consuming. The device is easily hung onto the patient's bedside, thus providing protection to the nearby patient. After the exposure was made, the device can be easily folded and hung onto the mobile X-ray machine to be used in the other wards. With that, I thank you to all.
For your interesting presentation. Now it is open for discussion. Do you any other question and comment? Yes.
Other than perimeter, did you use any personal perimeter?
We're going to use it in our next measurement.
Your device is adopted by all the hospitals in Malaysia.
We have been to all the government hospitals in Malaysia, trying to convince them to use. Do you know the material you use to fabricate the device? This the recycled material lead or what? That here.
Any more question or comment? Okay, thank you very much.